Welcome to the Cheer Athlete. Today I have with me Taylor, the hypermobile Cairo. And I just looked up your last name, and I know you're from Colorado Springs. Thanks for joining me, Taylor. Tell us a little bit about your background, number one in cheer, but mostly how you got into chiropractor as a hypermobile athlete.
Yeah, absolutely. Thanks for having me. So I started cheer at All Star Cheer when I was 8 years old, did it all the way up through my senior year of high school. I actually got to cheer on Lady Jags, which was the highlight of my life. And then recently, last Worlds, me and a couple of my old teammates went to Worlds to cheer them on for our 10-year reunion, which made me feel really, really old, but it was really, really awesome. And they ended up winning. So that was really cool. And cheer is part of the reason that I became a chiropractor. I got injured like most of us do in cheer at some point. I fell on my head doing a tumbling pass and ended up having to go to the chiropractor at that time. And that kind of opened up my world of what chiropractic was. I knew I wanted to be in the medical field my whole life. And when I went to undergrad, I went to FSU, Go Knowles. I was pre-med all the way through. And then I studied abroad in Spain and I took an alternative medicine class in Spain. That's when I really realized maybe the MD route wasn't for me. That wasn't really how I wanted to work with patients. I wanted to be more one-on-one and really create that rapport and have more of a coach relationship with my patients in a way. And so I applied to chiropractic school the second I got home from Spain, and the rest was kind of history. As far as the hypermobility piece goes, I've known I was hypermobile my whole life, pretty much. Well, since like second grade, which is very, very rare. Most people don't find this out until they're an adult. And I was really lucky because my mom really advocated for me when I was a kid. And that allowed me to have different things like occupational therapists as a kid, physical therapists as a kid, that really set me up for success. And I didn't really notice my hypermobility until I got to college, when I didn't have those support systems anymore. And when I stopped cheering, when I stopped exercising in the way that I was, when I stopped conditioning in the way that I was, that's when a lot of my issues started to come about. And then I started posting about hypermobility around my third year of Cairo school. And I didn't ever expect to treat exclusively hypermobility, but I am so glad it found me, and now we're here.
That's awesome. That's a great story, like transitioning and looking into the alternative. I like how the alternative medicine kind of sparked your interest in that, because I think we have a growing trend, and I don't think it's going to be alternative in the long term. I think it's
Yep.
in the short term. I thought you said that not a lot of kids get diagnosed with hypermobility, or they don't necessarily get the treatment they like, and that your mom advocated for you to get the help that you needed. Why do you think that is? Like, why do people not get diagnosed until they're adults?
Yeah, so it's really an education issue. We don't get taught about this in school. We had one slide on it in my entire education as a chiropractor. I've spoken to multiple PTs. Theirs is the same. I've even spoken to MDs. They don't have much more of this education either. It really is an education issue to start. The second issue is that let's do some definitions first. So hypermobility means that your joints go past their end range of motion. If that happens in 5 or more joints in your body, you have what's labeled as generalized joint hypermobility. Now, I want to preface this with, just because you have generalized joint hypermobility, just because your joints go past their end range of motion, does not mean you have a connective tissue disorder, does not mean you have Ehlers-Danlos syndrome, but it can be a characteristic or a trait. And if you're experiencing any sort of pain or any sort of, in my case, it was more so like developmental stages I wasn't meeting. I wasn't able to hold a pencil in second grade. I should have been able to do that by then. If you are experiencing something in that realm and you have 5 or more joints that go past their end range of motion, it might be worth speaking to a doctor about. And so back to your original question, why I think that it's so hard to get a diagnosis is because, one, a lot of doctors don't know about it. Two, there is no real criteria for children right now, which is a big, big problem. Three, most people don't become symptomatic, like truly symptomatic, until there is some sort of traumatic event or a hormonal change or an infection that brings on symptoms. That's what we're starting to see the trends and the hypothesis. So a lot of people won't really experience any symptoms until maybe they hit puberty or they have some sort of traumatic event, and that can also delay diagnosis. And now in the adult world with TikTok and everything else, it's starting to become a trending diagnosis, which is causing a lot of issues. I have a lot of clients that will go to doctors and they'll ask them about this, and the doctors will say, "Oh, that's just a TikTok diagnosis. Don't worry about that," and dismiss them, which is not okay.
Yeah, that's disturbing. That's a
Yeah.
and that's, what I think is great is that you're creating medical information and spreading medical information that is actually factual to like give, do you have these five hypermobile joints, and what is your function like? And hey, yes, you should, like, that's clinical findings and clinical pearls for people to look at. So that's huge.
Yeah.
I know here in Massachusetts, like, I'm in central Massachusetts, and I had one client probably about 10 years ago for personal training who um, was diagnosed with Ehlers-Danlos, and she had to go to Providence, which is, it's only an hour away, but like there's nobody in the area that actually, I don't think there's, I know that physicians know about it, but I don't know that they're actually informed about it. And so do you find that like, I think spreading the information is the key point, and getting the information out there is really important, because I don't think there's a lot of doctors that actually treat it. And um if they're blowing it off, like that's, or not blowing it off, because I'm sure they're not trying to just brush things off, but just calling it a TikTok diagnosis, that's
Yeah.
concerning.
Yeah,
Yeah.
100%. And so a couple of things that I think we can all do to help in this situation. One, prepping your patients for what the diagnostic checklist looks like. And so if you go and Google 2017 HEDS diagnostic checklist, print that out, bring that with you to your doctor, and ask them to fill out the first and second part with you, and then to refer you to a geneticist for a genetic connective tissue panel to rule out any of the other types of EDS. There's 13 or 14 now, but it's always changing. I think there's 14 now types of EDS. All of them have a genetic marker except for the hypermobile type, which is the most common type. And so you need to get a genetic connective tissue panel to make sure you don't have any of those types. And then if you pass the rest of the criteria, which is having 5 or more joints that are hypermobile, and then there are some systemic questions, as well as being in chronic pain or experiencing joint subluxations. If you pass that part of the criteria and you get the blood work that you don't have any of the other types of EDS, that's how you get diagnosed with HEDS. So even if your clinician or your PCP is not knowledgeable on this, bringing in that piece of paper can be really, really helpful. And if that's not an option, if they won't send you to a geneticist, Invitae has a out-of-pocket, it's like $350 for a genetic connective tissue panel, and a geneticist will call you. It's not going to be a formal diagnosis in that case, meaning insurance isn't going to come on in and help you out, but it can be really good for validation for yourself. The other thing that I think it's good for everybody to know is the EDS Society has a practitioners list that you can go on and look in your area and see if there's somebody in your area on that list. That's usually a good place to start. And then for cheer coaches in general, if you're noticing somebody on your team who's super, super flexible, they don't really need to stretch, their body positions come really easily to them, but their body positions and kind of tumbling and jumps look a little bit like too bendy in a way. I know I would always get yelled at because I would do the like frog leg thing in my back handsprings, or when I would step, my legs wouldn't always be together. That plus any sort of consistent dislocations. I dislocated my shoulder like 6 times when I was little. Like that should have been and it was, but it should always be a sign. If you have an athlete that is super bendy and is having dislocations consistently, that is a good enough reason to go get them screened for some sort of connective tissue disorder.
Yeah, most people I see different social media channels are, they're like, oh, we need to do more flexibility work. And I think that's a key thing. Like there are a lot of kids out there that are, and we're going to talk about this in a second, but that are actually more flexible than they need, and they need that stability, or they need they need different control. And so having that flag, like, oh yeah, they might need a little bit more. It's not their frog leg and their handspring is not necessarily a flexibility issue, but maybe a stability issue, or may need different work done.
Yeah, or a strength issue a lot of the time too as well. And with body position specifically, so there's a difference between flexibility and hypermobility. Flexibility is your muscles' ability to lengthen, whereas hypermobility is your joints' ability to go past its end range. You can be hypermobile and not flexible. You can be flexible and not hypermobile. A lot of the time they do come together, especially in younger females. And especially if they picked cheer as their sport, it probably was because it was easy for them and it was fun for them and they were good at it. They're probably both. They probably have both. That was my situation. Stretching, I never really had to do it. Body positions came really easily to me, but the stability aspect didn't. So I could do a needle, no problem, but my leg was always bent. My bottom leg was always bent because I didn't have that stability in my hips on that stability leg side. And knowing what I know now, if I would have trained differently when I was a kid, that could have easily been fixed, easily.
So let's talk, what's the difference between general hypermobility syndrome and Ehlers-Danlos?
Yeah. So,
or is there?
So Ehlers-Danlos syndrome is a genetic connective tissue disorder, meaning it happened when you were born. There is nothing that you could have done to change it. It's in your genes. You got a bad deck of cards, if you will. It is a connective tissue disorder, which connective tissue lines everything in our body. This is why it is a systemic disorder, meaning it can affect your GI system. It can affect your brain. It can affect every system in your body. It is also a spectrum disorder, meaning some people will be on this end of the spectrum and experience different symptoms than somebody on this end of the spectrum. That is different than something called hypermobile spectrum disorder. And so I want to kind of preface this from the very beginning. So generalized joint hypermobility is the top of our pyramid. 5 or more joints in your body are hypermobile. Then that comes down, you have asymptomatic generalized joint hypermobility. This is where probably Simone Biles fits. She's obviously hypermobile, but seemingly doesn't have any true systemic or any symptoms going on. Asymptomatic hypermobility does exist. And then there's symptomatic generalized joint hypermobility. This means that you're either in chronic pain or you have subluxations or joint dislocations on a regular basis. And that then stems off into connective tissue disorders from your genes, and then acquired issues. Acquired symptomatic hypermobility can come from trauma, a car accident, falling out of a stunt, falling on your head and you're tumbling. It can come from a traumatic event. It can come from an infection that we're starting to see. COVID is starting to be a part of that story. We're starting to see EBV as a part of that story, things in that realm. And then the genetic side is the connective tissue disorders. This is Ehlers-Danlos syndrome, Marfan syndrome, Lloyd-Dietz syndrome. There's a lot of others. It's not just EDS, but in females specifically, EDS is the most common, whereas in males specifically, Marfan's is more common. And so when it comes to EDS specifically, there's 14 different types. The one without a genetic marker is HEDS. Now there's something called HSD, which stands for hypermobile spectrum disorder. This is basically the same thing as HEDS as of right now, but it is a different diagnostic criteria. And so if you don't meet the very specific systemic questions from the HEDS checklist and you rule out all the other connective tissue types, you might get diagnosed with HSD or hypermobile spectrum disorder. From a musculoskeletal point of view, so from PTs, chiropractors, OTs, it is treated exactly the same. One is not more severe than another. Treat them exactly the same. And if anybody's listening that has HSD, don't gaslight yourself and think that you don't deserve help because you don't have HEDS. It doesn't work like that. Science is always changing. The Norris lab is currently doing studies to find that gene for HEDS. And once that comes out, which hopefully will be really soon, actually, this is all going to change and this will all be outdated, but that's where we're at right now.
Oh, that's a wealth of information there.
Lots of
You know,
information.
and I'll find the that 2017 checklist and leave that in the show notes so that people can grab it from there too.
Perfect.
Are there, so if there is a parent at home and or a coach, and you suspect that something's going on, and you've looked at different, well, so I use the Baton scale. Is that same? Yeah. So looking at, does your thumb touch your forearm? Can you palm the floor? And I'm not going to remember the other ones off the top of my head, but there's like 9 different things, and so 5 out of those. What other systemic signs might be? So like we talked about, like dislocations or hitting your head, and of different traumatic things that might send a signal that you do have either EDS or hypermobility disorder. What other things might somebody look for if they're struggling at home, and just like, hey, there's a flag? Is there any other big glaring things?
Yeah. So I'll answer that in a second. So with the Baton scale, that's a really good, easy first screening tool, and any clinician can just look that up. For non-kids and for non-athletes in the diagnostic clinical setting, the Baton scale is not the only scale you can use. There's also something called the 5PQ. That is a questionnaire, because hypermobility as you get older can decline. And so you might have been hypermobile in the past, but no longer can do this. That doesn't mean that you don't still have something in this realm. And there are other scales for hypermobility that are more lower extremity focused, because the Baton scale is pretty upper extremity focused. The lower assessment limb test, I think is what it's called. You can find all of these on my website though, and I'll give you the details for that. But the Baton scale is a great first screening tool, but it's not the only one you can use. So I just wanted to preface with that. But as far as systemic things to look out for, so some of the bigger ones are pelvic floor issues. Prolapse is really, really common in this population. Hernias can be really, really common in this population. GI issues like IBS-like symptoms, so having diarrhea or constipation, wavering. And then something called dysautonomia is really common in this population. And some symptoms to look out for that specifically would be low blood pressure, dizziness, nausea, especially if you're going from lying down to standing up or changing positions and you're experiencing these symptoms, brain fog, blood pooling, anything in that realm. Having sensitive skin or getting like rashes a lot of the time could be a red flag for something called mast cell activation syndrome. And so HEDS, dysautonomia, and MCAS are now known as the triad. They're seemingly all always coming together in some way, shape, or form. The data on this is constantly growing. And so everything I'm saying right now has limited data. There's not a lot of research in this field, but it is growing day by day. And because of things like COVID, we're getting a lot more research than we ever have. So what we're seeing right now is those 3 usually are a pair and they're coming together. And then slow wound healing, bruising really easily is another sign. Having like translucent like skin, like I used to always as a kid get embarrassed. You could see my veins really easily, and I would always have to get a spray tan before competition. So that could be something to look out for, things in that realm.
So like all of that sounds really scary, and but it doesn't mean like this is the end and like all this crazy stuff is going to happen. There's like we talked about a little earlier, like there are treatments available. So I'm going to preface this with my view of chiropractors have changed in the last 10, 20 years, as I've gotten to know more chiropractors. So my baseline was you go in and you just go in for maintenance treatment, or not just maintenance, but for preventative, and it's all manipulation. And but in the last bunch of years, I've learned, and I've met a lot of chiropractors. There's a lot more, and you have a wealth of knowledge, and you really look at medically, and dive into more. My question is, what whether it's chiropractor or PT, like what would a treatment look like, and what type of things should I look for in physical therapy, and what kind of things are you doing in chiropractic care for someone with hypermobility?
Yeah. So, chiropractic in general, I'm completely virtual, so I don't adjust anybody. And chiropractic is a lot more than adjustments now. And I actually have a podcast on this called Chiro Shift. If anybody wanted to look into what chiropractic is becoming, which is really exciting and really cool. For hypermobility specifically, again, it's a spectrum. So everybody's going to need different things. But from a musculoskeletal standpoint, so from your muscles, your joints, pain, subluxations, dislocations, something that a PT, chiro, OT can really help with. The biggest thing is gaining safety and a positive experience with movement, and gaining strength and incorporating strength training in with your cheer athletes. That's the one thing I wish I did as a kid. Instead of running a mile for punishments or doing 20 burpee tucks, if we were doing deadlifts, or if we were doing true weighted squats or true cleans and presses, that would have been so much more beneficial for everybody, but especially your hypermobile athletes. What happens to our ligaments when we're hypermobile is they become like an overstretched rubber band. They don't bounce back. When this happens, our body's only job, all our body cares about, is creating stability, is creating safety and making sure we don't die. Doesn't care about anything else. It's just like, is she alive? Is she alive? And so what happens is our muscles say, there's no stability here. I need to help out. I'm going to get really tight and provide that stability for her. That's great and all, but if they're not strong enough to do that, they only have so much capacity. They're going to get fatigued and they're going to get tired, and then you're really loosey-goosey, and that can lead to some scary stuff. And so having strength training a part of your treatment plan for hypermobile athletes or hypermobile patients is critical. That's the number one piece of advice I could give. And for cheer in general, I really think we need to start looking at strength training as a baseline for conditioning, as a baseline for what you are incorporating when you are practicing, instead of running a mile when we do a 2-minute, 30-second routine. Why are we using running a mile as conditioning? It doesn't make a lot of sense.
Right.
Yeah.
Yeah, I like, and even, and this is not to disrespect anybody that's doing this as exercise, but we do a lot of, but there's a lot of strength training and her with body weight. And I actually absolutely think that you need to learn how to do the body positions and get things correct before you dive into your PR on a deadlift. But that being said, like we've been traditionally so afraid of lifting anything heavier than a 2-pound pink dumbbell, and
Yes.
and ankle weights, and like there's only so much you can do with that. And yeah, like sometimes I think in acute rehab, you can make a justification for it, but like not for the long term, and not for building the strength that you're talking about. And I 100% agree with that. And I think it's a big piece. I do think that there's a lot of us speaking out about this now, so that's a good thing.
Yeah.
But
Agreed. Yeah. And so as
um,
far as what a chiropractor can really help hypermobile athletes or hypermobile patients in general, be careful is my first advice. Not all chiropractors are the same. Judge the professional, not the profession. Look at the EDS Society practitioners list. Make sure that they understand what's going on in your body. Do a little bit of research before you just go see somebody. And I would say the same exact thing for a physical therapist. This is not just for chiropractors.
Yep.
It is contraindicated, meaning a big no-no to adjust your neck if you have a connective tissue disorder. And so be aware of that. It's also not necessary if you have too much range of motion in an area. We don't need to be adjusting and putting more range of motion in that area. There's a lot of other things that you can do to get that same level of relief, like soft tissue work, working with things like cupping or a TENS unit. I have a lot of clients that will do that for themselves at home. I teach a lot of self-management strategies because with these conditions, flare-ups happen. And if you can have the confidence to get through that flare up on your own without depending on a chiropractor or somebody for manual therapy, to me, that's a big, big win. So that's a lot of what I do with my clients is we work on flare routines and self-management strategies to get our flares less intense and less frequent. And then we also do a full-on strength program for all of my clients that is going to start at their tolerable starting point and work within any comorbidities that they might have.
That's awesome. I think that's, incorporating the realm of it. And, inevitably people want that, whether it's, I'm going to say touch, but like the cupping, and something to be able to manage their symptoms and their flares. And I think being able to give them a tool that teaches them how to do that on their own is crucial, really, because people think I got to come to you and you got to fix me, and it's like, no, we can work together, and you can. Your body has the ability to fix itself. Here's some tools for that. So that's a great program that you're offering.
Yeah,
What
and go for it.
Go ahead.
I was going to say, and going off of the original of this stuff sounds scary, I want to emphasize that you can live a amazing life. You can cheer at the highest level with these conditions. You just need the right guidance. You just need the right support. This is not a progressive disorder, meaning it doesn't just get worse on its own. If you learn to manage it, you really can do literally anything you want to do. You just need the right support system and the right guidance and the right tools around you.
I think that's a key point, because I think, you get the diagnosis and like, am I going to come down out of a cradle? Not, forget landing on your head in a handspring, which not everybody does, but at some point it can happen, and it's not unusual. And it doesn't have to be an injury per se, but like coming out of a cradle and just landing, and am I going to dislocate my neck or my shoulder, and like having the tools and recognizing like you need to do the work to reduce your risk, but you can get stronger to help, to allow you to continue to do that. So having those resources is key.
Absolutely. And I would even say that being an athlete and being in the cheer world helped my musculoskeletal issues. The second I stopped cheering was really when my shoulder dislocates all the time. It has a torn labrum in it, and when I stopped cheering because I wasn't exercising really anymore, I went to college and I was like, I didn't know what to do. And that's when things really started to pile on. And I see that in a lot of my clients, that they become more symptomatic after stopping their sport. And so if you are an athlete, keep the skills and keep that kind of work ethic when it comes to your physical health that you had in your sport. When you retire and when you get a little bit older, it will really, really serve you.
I didn't start strength training until like my probably junior year of college, like towards the end of my cheer career. And even though like we learned the basics in PT school, but like I got into it and I enjoyed it. And then when I started working, started diving more into it. But I think the more we can teach the health aspects, like there is an article, and I haven't read the article yet, that just came out about how dangerous cheerleading is. But it doesn't have to be. It can, like when we look at the work and it can be an actual great foundation. Like if I didn't start strength training when I was a cheerleader so that I could get better, I wouldn't still be into it today. And that would be, my body would be more at risk as an older adult now, and so like the lifestyle gains and the foundation that we build through cheer. And if you keep that going, and whether you cheer in college or not, you just keep those health gains going, it's gonna stay with you for life, and those habits will become good, healthy habits. So that's a very key takeaway.
Agree 100%. And I can genuinely say the lessons I learned through cheer are the reason I am who I am today. I haven't read that article, but yes, there's dangers in any sport. The pros of cheer, being with a team, really working for something that is different than anything else, in my opinion. Sets you up for such a good work ethic as an adult. And so don't let a scary article stop you from participating in this sport. I think it's the best sport in the world. I will say, I think coaches specifically can do a better job at portraying what true health is, especially with eating disorders and body image and all of those things that we know are issues in this sport. I think if we started prioritizing those specific things a little bit more, cheer would be a lot safer of a place.
Yeah, 100%. Speaking of nutrition, do you, is there anything that this population can look at to avoid or add, make sure that, just not even on supplement wise, but on general nutrition wise, that's, is there anything in particular that stands out? I'm not talking like as a causal effect, but like eat more protein, you're going to help build your muscle, but
Yep, I was going to
along
say
that
high
lines.
protein.
Yeah.
Yep, high protein is the most important thing for this population. If you are dealing with something called mast cell activation syndrome or some of the other stomach stuff like gastroparesis can be a common comorbidity for this condition, you may need to look into a low histamine diet, but I do not recommend just doing that blindly. Work with somebody because it can kind of risk your relationship with food, and that is always the most important thing. The number one thing we see with this category is under eating, and so making sure you are fully nourished. And if you are feeling pain after you eat, that is not normal. Ask for help. I think I've had a lot of clients say like they didn't know they weren't supposed to be in pain after they ate, and that's why they didn't eat as much as they needed to. If you're experiencing pain after you eat, please ask for help. Go see a GI doctor, ask for help. That is not normal. But eating enough protein is really, really important. And then potentially you might have some sensitivities to some seemingly healthy foods that might not be the best for you. But again, that's an individual situation, and you should work with a registered dietitian to figure that specific piece out.
Great information there. And I think I hear a lot of common themes in the under eating. Like I think that's a big problem in a lot of different disorders that we see in cheer. So and I think that a lot of that does stem from our history and our striving to not put on weight, but it just, even without hypermobility, we need the muscle, we need our strength, and you get that by fueling your body with good food. So
Exactly. Yeah. Fueling your body is so important. It's going to make you a better athlete too. You'll have more energy. You'll be able to put on muscle easier. Tumbling will improve. Your jumps will improve. It's really important. I know that there is a stigma and you have to wear a crop top. I've been there. I get it. It's more important that you eat.
100%. So what do you have going on? Like what programs do you have going on? Is there anything that's coming up for you?
Yeah, so I have a couple of different things. We just started a clinician course. So this is a course for PTs, chiros, OTs, any musculoskeletal clinicians to learn more about how to treat this population specifically. It goes from the very beginning through the diagnostic journey all the way through the rehab process and everything in between. And that you can find that on my website. And then I also am a part of something called Clinical Concepts, which is a mentorship for chiropractors specifically who want to treat more so in an evidence-based way and not so much of that just adjust and call it a day. And then we also have a podcast called Chiro Shift, which is talking about what chiropractic really can be and how it can really help for all musculoskeletal issues. And then my own program is I work with clients one-on-one. It's one-on-one hypermobility coaching. I do only work with adults right now, but if you do have a child who is dealing with this, I highly recommend Hannah Sadowski. I'll give you her information. She's amazing with kids. She's amazing with this population specifically. But if you are 18 or older, I do one-on-one hypermobility coaching where we go through a full strength training protocol for your needs, as well as a full flare routine, like we talked about before, to decrease that intensity and frequency of your flares.
Awesome. Yeah, I'm gonna. I've heard Hannah's name before, so I definitely gotta.
She's the best. She's the
Yeah,
best. Yeah,
yeah.
she's awesome.
And I think there's a huge need. Like, there's a lot of former cheerleaders who are, now adults and absolutely can benefit from, working with you and talking with you. So I applaud everything that you're doing. I'm really excited for it. Doing great stuff.
Thank
How
you.
can people reach you if they want to, what's your website? And I know I follow you on Instagram, so
Yep.
are there
So
any other ways? Yeah.
find me on Instagram, the Hypermobile Chiro. You can find me on TikTok, the Hypermobile Chiro, and then the hypermobilechiro.com. I have a lot of resources on my website as well. If you go to the resource section, that's where you could also find the clinician course. You can find the 2017 diagnostic checklist and the EDS practitioners list there as well. So definitely check out that.
Perfect. I'm so glad that we got to talk today, and I can't wait to keep learning from you and with you, and keep spreading the message, to get strong, to pay attention to your body, and keep, spreading the word of how that, it doesn't have to be it can be a very safe sport. And if we create those resources and keep us moving in the right direction, creating good body awareness. So
Absolutely. Absolutely. Yeah. Awesome. Thank you for having me.
thanks for joining us today, everyone. Don't forget, when in doubt, breathe it out. Take life one step at a time. You can do anything you put your mind to. And as my friend Drew Kelleher said, you're responsible for your own vibes. So go get the day.